So well-being, I guess, is what we're all aiming for, but what starts to happen when we're in constant pain or we've got something else chronic going on in our lives? So that feeling can hijack parts of our central nervous system, and it can take us, I've got a little roller coaster there, because it can take us on a roller coaster ride between feeling good, feeling great, doing a lot of activity, getting really involved in things, and then perhaps feeling pain and not doing so much at all. And this can create sort of like a vicious cycle, a bit of a circle that we can go through, which can be really exhausting, and also, contribute to us feeling burnt out as well. So it can really feel like, I guess there's a roller coaster, almost maybe like a merry-go-round as well. So here's an example of what we call the pain cycle. So when we're feeling pain, on the one side, we've got about how we feel. So we might feel anger, anxiety, fear or distress, and that can decrease our mood and lead us towards feelings of depression and that sort of depressed feeling. And that can sometimes give us an increased perception of pain. So even though the pain, the pain we're feeling is very real, but the perception of it can be heightened as well. And on the other side, we can start avoiding activities. And this can start to lead to deconditioning. So, feeling like, or not being able to do what we could previously do. And that can then lead to more pain because we're not being as active, and so we avoid the activity more. And so there are these cycles that we can fall into with pain. And thankfully there are strategies that can help us. And it's a lot about finding a solution that works for you. It can be really individualized based on what your situation is and the type of person you are. So part of that is, a part of managing is about the type of person you are and knowing yourself. So you can see here on this triangle, there are things in the sort of the category of doing. So finding different ways to do things. So like goal setting, pacing and relaxation, which are some of the things we'll talk about today. There's the knowing side of things. So working on your mindset, accepting, changing, ways of thinking about pain, and techniques that are part of CBT, cognitive behavioural therapy, and also in the sphere of being. So the sense of self and how you frame things as well, and it's related to time. So all those sorts of things can fit together, and you can tailor a way and a solution that sort of works for you and sort of gives you the most benefit for your situation. Today we're going to talk about 3 main strategies to manage pain. You may have heard of some of these before. You may have heard of them with different names. We're going to talk about controlled breathing, which can help deal with the stress and anxiety that comes with pain and bring you sort of into that present moment. We're also going to talk about pacing, which is a way of smoothing those highs and lows that we were just talking about with the roller coaster. So instead of sort of having that peak where we feel like we can do a lot, and then going down to sort of having no activity, sort of trying to pace things out so it's a bit more even. And also the last technique we're going to talk about is stepladders. And this is a safe and measured way to sort of build up to activities when you're experiencing pain, and sort of try and disrupt that cycle of when you're feeling pain, not doing much, and then deconditioning. So sort of trying to smooth that over a bit too. So just to talk a little bit more about stress and performance. So a little bit of stress, you may have heard this, especially with corporate approaches to performance. A little bit of stress can actually be really helpful for our performance. It helps us stay out of that boredom part of the graph that you can see here, and give us that little bit of extra motivation and boost to be performing at our optimum level. But if we get too much stressed, as I'm sure we've all experienced, that starts to tip us into that feeling overstressed, and our performance starts to go down. So if you've ever had like a course deadline or a work deadline to complete, it's hard to be motivated to finish without a little bit of stress. It can help you motivate and sort of get through the problem. But if there's too much, sometimes you shut down, and it's a similar sort of thing with pain. Pain is a signal from our body that something needs attention, or that we need to rest. And a small amount of pain, that may sound strange, can actually be a little bit helpful. It's giving us a message, but too much, that's when we really start to get overwhelmed, and it's makes life a lot harder, makes it hard to function. Okay, so when we're in that place of high stress, it can tip our bodies into that. You may have heard of the fight or flight response. So the small, shallow breathing that we do when we're stressed, body becomes overloaded, and our brain sends signals to our bodies. So, and this sort of response is really good. Say that, you're trying to escape from a bear. You're either standard fight, which is probably not the best thing with a bear, or flight, you run away. And that's really helpful in those sort of situations. But with something like chronic pain, there isn't an immediate threat. So your body can stay stuck in that mode, waiting for, a bear to fight that never comes. So using controlled breathing, which is the first technique that we'll talk about, can help us move back into that rest and digest mode, that mode of being a bit calmer, settling the response a bit, and then we can get our thinking brain back online and respond better. So I thought maybe the best way to have an introduction to controlled breathing is perhaps if we give it a try. So I'll go through these instructions first, and then maybe we can try it a few times together if you're comfortable. So first of all, hopefully you're in a place that's quiet and comfortable where you won't be disturbed right now. So the first thing I'll ask you to do is to close your eyes and breathe in through your nose to the count of 3. So a nice sort of steady pace of 3. And then once you've done that, I'll ask you to hold for a count of 3 at the same sort of a pace. And then we'll breathe out again through your mouth for the count of 3. And then we'll hold that for 3. So it's sort of like if you think of maybe like a square, so, in, hold, out, hold, sort of do that. And we won't repeat it for 3 minutes, but maybe we'll do it 3 times and see how that feels for you. So if you're comfortable to give it a try, just gently close your eyes if you're ready, or focus on something in the room if you'd like to keep your eyes open. And if you start by breathing in, 2, 3, 4, hold, 2, 3, 4, and out, 2, 3, 4. We start again, breathe in, 2, 3, 4, hold, 2, 3, 4, and out, 2, 3, 4. And one last time, we'll breathe in, 2, 3, 4, hold, 2, 3, 4, and out, 2, 3, 4. Just curious, how did anyone find that? Does anyone have any reflection on how that was? Does that feel calming or a bit strange? Relaxing, Jamie? Oh, that's good to hear. Just anyone else? Give it a sec. Yeah, so if you do that on a regular basis, you can get more used to it, and the benefits can kick in a lot quicker. Yeah, do it when you're going to sleep. That's a good idea, Amanda. And Libby says she finds it good to centre herself. Yeah. So that's great. So the more you do that, and if you try and practice it on a semi-regular basis, then when things are getting overwhelming, it can be easier for that to have a benefit and to sort of kick in there. Thanks. Thanks for coming along on that one with me. Okay, so talking about pain and extremes. So when you're feeling good and you're having those good days, it's normal to do a lot. So you feel like, oh, this is great. This is a relief. I'm having a good day. I'll get everything done that I've been wanting to do. But doing activities can sometimes cause the pain, which can heighten those bad days when they come, when you don't feel like doing much. And it can create a bit of a cycle, like we were talking about earlier. So the next technique that I want to talk to you about is called pacing. And it's about doing activities based on time rather than on how your pain is going. So the idea here is to try and, instead of having the big highs and lows, is to sort of, as you can see with that dotted line, sort of smooth out a bit of that high and low cycle you fall into. So here we can see, again, it's a vicious cycle. So if you're doing a lack of movement and there's increased pain, that leads to overdoing things on the good days, that leads to increased pain, and so you require more rest, to take things easier, and that can cause fear or increased inactivity, and so the cycle goes on again. So pacing, the idea is doing things within our limits. So here you can see there's a bit of a traffic light system for sort of talking about activities and sort of rating them based on how difficult they are. So green are the easiest, yellow is a sort of moderate, and red are the activities that are most difficult. So most people tend to stop an activity when they experience pain. And the old way to deal with pain was to rest. But as I was saying before, the research suggests that constant activity within reasonable limits, there's a safe zone that can help to sort of smooth things out and sort of not create damage. So let's talk a little bit about what pacing actually looks like. So what we might do is, I might get you to, if you've got a piece of paper there, if you've got something that you can note down, I'll go through these instructions. So if you write down a list of some of the bigger activities that can cause pain. So this might be cleaning the house or going to the gym, something that's sort of like a bigger activity. And the next thing that we do is we break that activity down into smaller timed tasks. So cleaning the house, you might break that down into vacuuming, doing the dishes. Going to the gym, you might break that down into, okay, I want to use the exercise bike, the rowing machine, and the treadmill. And then with those activities, you add those timed tasks into a weekly schedule. So you might say, okay, on Monday I'm going to vacuum, on Monday I'm going to use the exercise bike, on Tuesday, and so on. So as it says here below as well on the slide, don't remember to check in with your doctor as well about which activities are suitable for you. And there's also an FAQ section for pacing on the Uprise app. So if you want to check that out, there's more suggestions there as well. So let's do a quick practice of pacing. So if you want to just take a few moments and write down some of those bigger activities that might cause you pain, and see if you can break those down into some smaller sort of timed tasks. So I might give you 2 minutes to have a go at that, and then maybe we can check back in and see how everyone's going, if how easy or difficult that was to do. So I'll just give you a minute or two. Okay, just starting to come back when you're ready. If anyone would like to share in the chat any things that they came up with, you can share with the group. But hopefully that helped you have a bit of a think about bigger things that you've been wanting to do, and how to break those down a bit, and then maybe then adding those time tasks into your weekly schedule, so to help a little bit. And yeah, the more, as with all these activities, the more that you practice them and the more that you incorporate them day to day, the easier that these sort of things will become. Okay, I might move on to the next one now. So talking about anxiety around pain. So one of the biggest challenges can be the anxiety that we feel around the pain. So doing certain painful tasks can cause our anxiety to increase. And if we follow through and complete the task, the anxiety can go down. And the next time we do it, the anxiety might not last as much, but it's sort of getting over that initial barrier of anxiety to sort of get in and get doing the task. So that's where the final technique we'll talk about, step ladders, can be helpful. So I guess the best way to explain step ladders is to sort of go through it a little bit. When it might be good to start with sort of an activity that causes you anxiety, but that write a few of them down that you do sort of kind of day to day, or that you need to do, and then rank them from easiest to hardest. So a good way to begin is to start with the easiest task on your step ladder and then gradually work up to the harder task. So say, for example, you're thinking about going shopping, and the things you might not need to do when you go shopping is you've got to drive to the shops. That's the first thing. You've got to lift heavy bags. You've got 1 hour of walking and 1 hour of standing, and all those things can cause pain and some anxiety as well. So you might rank these from easy to hard. So you might go, standing's the easiest, then walking, then driving, and then lifting is the hardest one there. So what you might want to do is, before you actually go shopping the next time, you might want to practice these. So you might want to try standing first and doing that for a certain amount of time, and then trying some of the other tasks gradually as you build yourself up. So maybe we can do a quick practice of step ladders, similar how we did with pacing. So if you just want to take, again, a minute or so to write down an activity that causes anxiety and break that down into some of those smaller tasks, rank those tasks from easiest to hardest, and then think about maybe how you could start on one of the easier tasks. So I'll just give you a minute or so to have a little bit of think about that. Okay, well, just coming back again, because I'd like to leave some time for questions at the end. If you do want to put some of the things that you thought of in the chat, that's great. And I know there's been a lot of content today and we've been going through it quite quickly, but hopefully some of these little practices has given you a bit of a taster for what some of these techniques are like. So just to go through some of the key takeaways from today. So feeling good can sometimes lead to overactivity, which can lead to further fatigue. So techniques like controlled breathing can help reduce the physical symptoms of stress and help with calming down. Pacing can even out that pain cycle of boom and bust and keep things a bit more constant. And step ladders can help gradually work towards tackling activities that cause anxiety, starting with the easier activities first.